Avoid sex during pregnancy if what I'm going to be discussing in today's video points at you. First thing first, why should you avoid sex during pregnancy? That is what I'm going to be tackling and break down in this video. So stick around and make sure that you watch till the end, because towards the end, I'm going to be telling you some things you can do in order to balance things up. Why sex during pregnancy is generally safe, but there are some specific situations whereby it can be very, very risky. Wait. This video is not about scaring you. It is about making sure that you are informed and you can take the best care of your body and your baby. Now straight to the point. Some conditions, medical conditions, can warrant you not to be involved in sexual activity during pregnancy, and they include conditions like placenta previa. If you are dealing with placenta previa, that is where the placenta covers the cervix. The cervix is a narrow outer end of the uterus. So imagine a placenta covering the cervix. Any sexual activity can result to bleeding. The same thing goes for preterm labor. Maybe during your previous pregnancy, you had a preterm baby. Then it is not advisable for you to have sexual intercourse during this present pregnancy, because it can trigger contractions and you wouldn't want to have your baby early as well. Also, cervical incompetence, that is when the cervix is not capable of withholding the uterine entrance. In such condition, doctors usually advise against having sex. Same thing also goes for short cervix. Somebody that have a cervix that is shorter than normal. This is usually examined also during previous pregnancy. If you've also had previous miscarriages or vaginal bleeding, or you are experiencing spotting, then it is not a good way to just go into sex without consulting your doctor first. Then another concern is the risk for infection. During pregnancy, a woman's body needs to be completely, if not 100%, at least work towards 100% protection, because your baby is at risk of being infected. Although the baby is protected with amniotic fluid that cushion the baby, the abdominal muscles, the uterine muscles, they help the baby stay protected within the uterus. But there are some infectious disease that can even bypass this protection. For example, sexually transmitted disease, STIs, it can still pose a risk. Now, there's another point whereby most pregnant women don't want to discuss it, but it is very crucial for you to say how you are feeling, because pregnancy comes with its own set of challenges. Some women during pregnancy, they don't even want to be touched. They don't want to go into any sexual activity. They are emotionally stressed. They are not physically okay. The mood, everything is not just in place. That is why it is better to communicate effectively with your partner. Discuss how you are feeling. Share your thoughts, because you need to put your need first. Prioritize what makes you feel safe and comfortable. Now, there is one specific advice that I want all women of childbearing age to take note of. You need to just take note. In fact, go and note it down. That the moment you realize that you're pregnant, you're carrying a baby, don't wait. Go and register for antenatal. This is very, very important, because I've seen many pregnant women that do come for registration after 6 months. Some close to the time of delivery, they will just be coming for registration. This is not a good way to go about it, because in the end, there are some conditions or complications that may later arise towards the time of delivery, which would have been prevented had it been they come early for antenatal. So that is why, if you realize that you are pregnant, be it 2 weeks, be it 2 months, just realize that you're pregnant like this, be coming to the hospital. You need to come and register for antenatal visit. And during your antenatal visit, discuss whatever you are feeling, whatever you want, whatever you desire with your physician. Talk to your doctor. They are there to help you anytime, any day. They will be the one to make the right decision for you, although you are the sole decision maker here, but they will tell you what is good for you and what is not good for you. Can I sleep this way? Can I eat this way? What can I eat? Say everything. You want to have a good and healthy delivery, right? That is why you should just communicate your thoughts. Now, what can you do instead of sexual intercourse? You can still maintain a healthy relationship with your partner by just cuddling, talking, or simply spending quality time with one another. You guys need to find new ways to bond together in order to ensure your safety and your health throughout your pregnancy. And I want you all to remember that every pregnancy is unique and each individual pregnancy may vary. What Mrs. A experienced during her pregnancy is not supposed to be what you are going to experience. So don't even go far by thinking that this person doesn't feel this way. Why should I feel this way? You are not the same, okay? You're not the same and it can never be. I hope I've answered the question and make justice to it. So if you have any question or you have any personal experience to share, leave it in the comment section. We are here to support one another, right? So if you find this video helpful, hit that like button and share it with others who might need to hear it as well. And don't forget to subscribe for more important health updates. See you when I see you.